first time that we've had a Daisy Award within surgical services, so we're going to start from the beginning. So just some people are like, what does Daisy even stand for? So Daisy stands for Diseases Attacking the Immune System. So a gentleman by the name of J. Patrick Barnes was a patient. He had diseases attacking the immune system, was kind of his diagnosis. And back in 1999, he passed away, and his family started this award, and it's an international award. And they wanted to give back to the nurses because of the amazing care that they provided. So that's where this started. So we do have an awardee then from Surgical Services, and we'll read the story to get things started.
Okay, well, good morning, everyone. I have the honor and privilege to read this story about this nurse. On 1/26/26, we had a late add-on surgery, a leg amputation. I went to see the patient to do the pre-anesthesia assessment. The patient had a particularly complicated medical history, including a psychiatric diagnosis and anxiety, plus numerous comorbid medical conditions. In addition, she had an IV that was questionably functional. As happens with late add-on surgeries, the OR staff is stressed and trying to move quickly. The patient had many issues needing to be addressed, including assessing the IV, labs, and pre-op medical functional status. I could see this was increasing the patient's anxiety further. This nurse was our circulator nurse and did a fantastic job getting through the patient's pre-op checklist. When done with that, this nurse could see that the patient was nervous, getting more upset, and sort of overwhelmed with this upcoming surgery. This nurse sat at the edge of her bed and asked her some other non-related questions to distract her and comfort her while I was assessing her IV status. She really spent extra time trying to make this upcoming life-changing surgery more understandable and hopefully less scary. This is especially admirable as the tone in the healthcare procedure areas is to ask, how long will this surgery take? When will we be done? Will this be a case that goes into call time? And what was your turnover time? I am so impressed that this nurse is willing to step outside this approach and address the comfort and mental status of a patient without considering the above factors. It is a refreshing attitude. So your Daisy Award winner from your surgical services is Dawn Ferguson. And it was submitted by Dr. Linzenbart. So thank you very much for noticing and paying attention. So Dawn, congratulations. Thank you for all you do. And thank you to all of you for all you do. You all make a very big difference in our patients' lives. So we appreciate all of you very much. It's a celebration for all of you because obviously we do not work alone. We work as a team. So thank you. So Dawn, you need to come up this way.